Here we go. Ready?
Alright, welcome to StormShannon.com. In this video we're going to do what I call the phase 1, the current phase 1 for low back pain protocol. So what I tend to find is in the low back we've got to focus on a few different things in order to get it fixed. The first part of this is we've got to get the muscles around the spine working correctly again. So the muscles we want to be concerned with that we've got to get firing correctly are the glutes, the multifidus, and the quadratus lumborum. If we can do that, a lot of the pain associated with the low back pain problems, whether it's a facet syndrome or a disc irritation, will diminish greatly. So what we're going to do today is we're going to talk about the major muscles that tend to get facilitated or very tight that will inhibit those muscles. So first we will attack the glutes. A lot of people, their glutes don't fire properly, mainly because in today's society we sit way too much. We sit at work, we sit in our cars, and so our glutes become deactivated. What tends to kick in to take over are the calves. The gastrocnemius specifically. So if the gastroc is very tight and facilitated, then it will also shut off the glutes. And now you're in this vicious spiral. So first we want to work on releasing that. What I found is that the outer part of the calf, the outside portion, tends to be where the biggest knots are that are turning off the glutes. So the first and easiest way to release that is by using a rolling pin. Yep, just a standard kitchen rolling pin. So you're just going to work down that outer part of that, and you're going to break that up. Finding those knots, try to spend a good couple of minutes on each side and release those. Watch your fingers, Raven. Thank you. So if you don't have a rolling pin, or if you happen to have a foam roller at home and you'd rather use this, another great way to do it is what I call the calf crush. And that's just putting that in behind the knee, getting it on the calf, and you're just going to sit back, put that weight on there until you get that pressure. And you can even rock back and forth or move side to side, and do that for 2 minutes. Raven, I need you to hold that steady. Quit moving around, okay?
Yes, Dad.
Thank you. So, that's the first part. That will get you to be able to activate the glutes. Once you can activate them, we need to fire them. So the exercise that goes hand in hand with that is the single leg glute bridge. So in this position, if I'm working the right glute, I'm going to pull my foot up in my ankle into dorsiflexion, so I can't use my calf. I'm going to bring my left knee up to my chest, and I'm actually going to raise my left arm so that when I lift and I bridge, I'm bridging here and back down. And then I'll switch and do the other side. And I'm just going to go back and forth, nice easy pace, for 30 reps on each side. So that's the first part to get the glutes going. The next part that gets the multifidus and the QL going, it revolves around releasing the shoulder blade area, primarily what's known as the teres minor group. And definitely look at the pictures attached either above or below this video, and it'll give you a better demonstration of exactly where these muscles are. But basically what we're trying to hit is right on top of the shoulder blade. Anything that is tender in this area should not be. So we're going to get in there, and anything that's tender, we're going to work those areas. For this, I like using a lacrosse ball. You can start with a tennis ball, but you might need something firmer. So lacrosse ball, street hockey ball, baseball, any of those things work pretty well. So for this, I'm just going to get into that shoulder. I'm going to lay on my side. I'm going to find those tender spots. I'm going to work and I'm going to hold pressure. I'm going to work back and forth for a couple of minutes on each one, trying to get those to really break up. Okay. Once I do that, then to get the multifidus to fire, I'm going to perform what's known as a bird dog. So on all fours, I want to put my low back into just a little bit of a curve, which is normal. And then I'm going to reach out opposite leg, opposite arm. Come back and I'm going to switch. My eyes are looking just out in front of me, not up, not down. So I'm just right here. If you have a foam roller, it's great for this exercise because I can sit it on my low back, get into that position to where I can balance that, and then I can work on reaching out and coming back. If you don't have a foam roller, use a book, because if your multifidus does not fire, what happens is when I reach out, my hip will drop and it will slide off. So it's a good cue for me to keep that pelvis level, which is going to keep that multifidus firing. Alright, so that's step one. Make sure and do that, and then watch the step 2 videos, which is about restoring range of motion to the hips. That's it for today.